5:30 p.m. and we will call to order the August 17, 2020 meeting of the MISD Board of Trustees. This meeting is being held by video and audio conferencing pursuant to Governor Abbott's temporary suspension of open meeting laws issued on March 16, 2020. As is our custom, we will begin with a moment of silence followed by pledges to the U.S. and Texas flags. Thank you. I pledge allegiance to the
flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. All right, agenda item 2 is our announcements, and we have a 2020 census presentation by Charlene McBride. Will she be joining us online or? Okay. Are we going to call her now or?
Oh, there she is.
All right, Miss McBride, welcome.
Thank you.
You have the floor. Thank you for joining us.
Thank you so very much for having me. I'm going to go ahead and give you kind of a quick update and a recap of what's going on with census and how we need help within the school district. Go ahead and go next. I think a lot of us maybe know why we do the census, but you'd be surprised as to how many people don't understand why we actually do the census and why it's needed. It is actually mandated through our Constitution, Article 1, Section 2 of the U.S. Constitution, where it states that we shall have a census every 10 years. The very first census was actually done in 1790. It was actually conducted by the U.S. Marshals. And of course, it took them almost 10 years to get all of their people counted. Now it's up to within a year time frame, which is when they want us to go ahead and conduct it and have it done. Next. This is really concerning to me. You know that number one, the biggest reason why they do our census is number one for apportionment. And this is to determine how many seats are going to be added or redistrict for our state. And the reason why this is important and kind of alarming in a way is that right now the state of Texas is at 58.9% on responding, which means, and in our national is 62.1%. Texas is ranked 39th in the nation. So if we're wanting to go ahead and see the potential for seats that they thought we were going to go ahead and have, this is dwindling if we don't go ahead and start bringing up our numbers. Redistricting is going to be the other issue. Once we start looking at redistricting figures and we don't have the figures that we need or want, that's going to be a concern too. Of course, we do also have it for funding. Federal funding, our school districts, our health system, our infrastructure for small business, for counties, cities, those numbers are always used also. So it's important that we try and see and make sure that we do have our numbers correct and as many people participating as possible. Next. This time for census, it's been the easiest, and that's, of course, doing it on the internet, doing it by phone or by paper format. There's a couple dates that we need to go ahead and pencil down as important dates because of COVID. It's really changed a lot of our operations. It's changed a lot of our response, really, because it kind of held up quite a bit. Our important dates, one is, of course, we call it NARFU, and that is the non-response follow-up. That's actually being conducted now. We started this in Midland County August 7th, and it will wrap up September the 30th. This is where people will go actually door knocking and interviewing individuals that have not responded. So we do have people on the ground already going through. I think this was last week was the first full week. Our numbers, so we won't be seeing a whole lot of those, but we're still asking people to go ahead and respond by the internet or phone, even though they have, or we have people going out and conducting the NARFU. The next important date is going to be our group quarters. Remember, group quarters was the one that we were really concerned about in Midland and Ector County, in the Permian Basin, really, because of all of the man camps that we had. Unfortunately, COVID hit right in March when we actually started this. They began April 7th, and they're now telling us that it's going to run all the way to September 3rd. The key question that we always have to remember is that, where were you at April 1st, 2020? So hopefully we'll still have those individuals or the companies, because the companies are the ones that are conducting a lot of the man camps and a lot of the group quarters, will be able to still keep some of those figures within the county. Service-based enumeration, this is when we actually start counting our soup kitchens, our shelters, and our vans, the vans that go out to service people that don't have transportation. That is going to be between September 22nd to September 24th. The homeless is something we really don't publicize the actual date, but what they're telling us is it's going to be sometime between September 3rd and September 28th. A lot of our service-based organizations help us out with that. So they will be informed as soon as they decide what date they're going to be doing it in Midland County. Transitory is when we actually start counting all of the RV parks, the campgrounds, the hotels, and here it's actually some of the centers, the big, huge gas station centers that are being brought up now, or that have the parking in the back. They will go ahead and start doing that September the 3rd to September 28th. It's important that we always let people know that they still can go online and by phone or mail back their questionnaire. They might get someone to go ahead and come in, but they always can let them know that they've actually returned their questionnaire. The key for the rural areas is to make sure that they do include that Census ID that's on your letter when you receive that, or your form when you receive it, because that actually matches you to the actual logs that we have. So whenever they receive that ID, it's automatically clicked off, so they won't have someone come and do the enumeration. But of course, one of the issues that we had was when we were doing the update leave, which is in Midland County, it's the outskirts of the county. These is where they don't receive mail at their homes. They actually were supposed to receive their questionnaire at their door. That's when COVID hit, so that operation was stopped. It actually began back again the latter part of June and July. So we're hoping that a lot of people will go ahead and start responding now that they have those. They indicated that we were probably about 98% finished in the areas with the update leave. But to be honest, I still haven't seen the response that we should have since we've had these forms out completely now. And then the mobile questionnaire assistant sites, those are the sites that you're going to be seeing popping up quite a bit. We've been very, very active in going out to some of these food drives. We've been to some of the schools that have the food drives. in getting phone numbers, and we call them back and we assist them in filling out their form. Those have been very, very good. We're still trying to come up with different virtual ways still to entice and to kind of let people know that we are here. We're using actually a local number and local individuals that can actually help them both in English and Spanish. And we have some other languages also that we can go ahead and assist too. Next. The questionnaire is very simple. It's only 10 questions. It's an average of 5 to 10 minutes that we can go ahead and help people go ahead and fill this out. We do use Census employees, so we are always covering the Title 13 confidentiality part. So we always need to make sure, of course, that we keep that safe. And we do indicate to the individuals when we're actually taking and helping them out that we are Census people, and Census individuals will be calling them back. Next. This is the part where we actually want to go ahead and talk about what is it that we can still do to get our numbers up. Next. We have partnerships with a lot of individual or a lot of organizations here in Midland. We have a very strong one with the West Texas Food Bank. They're the ones that allow us to go ahead and go to our partners or to their partners to go ahead and help and assist individuals with their actual census. We had a wonderful partnership with the PSP. They're the ones that actually set up the Permian counts. They were very, very strong in helping us out and sending out the message, and especially in the Permian Basin, how important it was for us to go ahead and have that. We continue to educate people about the 2020 census, letting them know and letting them understand why it's important for us to have these this done. A lot of individuals don't really even realize that some of the food banks that they're being part of is part of federal funding that they're receiving. A lot of individuals don't understand that some of the food programs that the schools have are through federal funding, and they use the numbers. And the important thing is that you're going to be using these numbers for the next 10 years. And that's what's so important, is that you can't change it. It's going to be the same numbers for 10 years. So we encourage everyone to participate. We come up with all different kinds of programs to help. Virtually, we've come up with radiothons where people can go ahead and respond through the radio. The radio donates us a half an hour or an hour of census. We're able to go ahead and help individuals fill out their form. We also have come up with Kids Count also. That's a program that we did back in May of this year, and we had a couple of the schools participate. I think Pease Elementary was the winner of Midland County on parents participating in numbers. So we had a contest, and we're wanting to go ahead and maybe do something like that again. We had a partnership with the Apartment Association, the Permian Basin Apartment Association, to see if we can go ahead and create interest there. So we're not giving up. We're still trying to go ahead and make sure that we do have everyone engaged on ready so that they can go ahead and start filling out their forms. Next. This is the map that you can go ahead and go through Texas counts. They have a unique map that's called the CUNI map. The CUNI map I like because it kind of tells you a little bit more and goes a little bit into more detail, and it's easier for me to use. But this is the national rate right now. It's at 63.4%. Texas is at 58.9% because I just updated it at 3 o'clock. Midland is still at 53.2%. And if you see, we have several pockets in the county that are still, they're still below 20%. Some of them are just a little over the 20%, so it brings them over. But the majority of the city, in the city limits, we're doing okay. It's the county that we're really hurting. We've tried to go ahead and use the school program, the lunch program. We've included a lot of swag, a lot of information for parents to kind of pick up and know a little bit more about the census and do the census. We've even actually gotten some hotspots that they've given us so that we can go to some of these locations and people can actually go on their phones or their iPads and go ahead and click on and fill out their form. Next. This is the one I want y'all to look very, very closely at. This is the undercount risk for young people. And if you see, this is 5 and under. And if you can see, you have a couple of very high risks in Midland County, and I'm surprised in the areas that they're in. Over on the south side from I-20, those are 2 pockets, and we actually went in and did a couple of churches. We also did a couple schools that we were able to go ahead and help in the food program to encourage them there. And then we did a lot of apartments in the area up here where it has grassland estates. That is the area that I was really surprised at, that we were having such a high risk in not counting 5 and under. These 2 maps are the maps that my team works with. These are the ones that as we go forward and start looking at areas that we really think will help, these are the maps that we actually look at and start planning as to how we're going to go ahead and address the low response rates that we're getting. Next. We have, I think we already passed the date, but we do have some YouTube and Facebook programs that Norma Ayers, which was our education specialist, but she's left. But she was able to go ahead and put together several of those to help the teachers in trying to implement into their curriculum how important the census is. And some of them had games in it as to what they could go ahead and do. But this is part of the SIS, which is the statistics in schools. I still have a lot of those links that we can still go ahead and use. I encourage principals and teachers that want to go ahead and have something extra to do. This is one area that we do. I still have a lot of the coloring books that we can do. We have some books for, I think it was 1 through 3, and then of course the kindergarten was the coloring books. We have maps that we could be using inside the high schools and also the junior highs that we can go ahead and still provide. So as for materials, we can always provide the materials for the teachers, and of course trying to go ahead and see how we can implement them through virtually. Next. Now, the last thing I wanted to go ahead and talk about was what is it that we can go ahead and do to try and see if we can get more interest. I know that the district has sent out text messages to the parents. I encourage them to continue to send those messages out, for the schools themselves to send out emails and text messages for them to please participate. We could even do another challenge like we did in May, to where we can go ahead and encourage parents. We had a raffle that we gave gift cards. We still have some gift cards that we can go ahead and still do that. We also were wanting to see on the launch page that you do for your, or the landing page that you do for your virtual classes, if we could go ahead and place the Census logo there with the website, so that they can go ahead and connect to and actually go ahead and start doing their questionnaire, or helping them anyway, and also the phone number. Those are one of the other things that we were wanting to go ahead and see if we could do. We can always go in, and once we can, go ahead and do presentations to the kids. We've done that in the past. We want to go ahead and see if we can still do it. So any ideas that anyone might have as to what we can do on, creating more interest, I just feel that we need to do it before. I mean, we only have until September 30th. And that is the challenge we have. Before, we thought it was October 31st. That's not the case anymore. So we were cut a month. So we now are really trying to see what it is that we can go ahead and do. The other thing is on the non-response follow-up. we want to make sure and assure everyone that everything is done in or matching. Oops. Hello.
We can still hear you.
Oh, you can? I lost the screen on here. But just to making sure that everyone knows that our enumerators that are out there are wearing their masks, they're maintaining social distancing, they have all of the gloves and sanitizers, and they're not entering homes. So everything is conducted outside of their homes. So does anyone have any questions?
Yeah, I do. Yes, ma'am. I have a question. I guess if you say y'all are doing the census with the people or the people that are living in man camps, is there any way, maybe I missed it, is there any way, a possibility that they could be double dipped if they just working here, but you're doing the census and you go back to their hometown and then you go and their spouse give you the same numbers or name?
There is that possibility. So they just ask that when they're doing when they're conducting it through the man camps, that they understand and they let that their families know that they have been counted there in the county, because that's where they're spending most of their time. That was the issue that a lot of people had, was that if you stay 51% of the time in one location, that's where you get counted. That's where the funds get to. So, and you'll have someone or some that did double or do the double, but we're hoping that not a whole lot of them did that.
Hey, Ms. McBride, this is Mr. Riddick. I want to thank you for being with us today to inform our community about what we can do as part of the census, because clearly these schools make an impact around that. You can continue to reach out to Elena Ladd, Chief of Communications, so you can stay in contact with how we can continue to work with you on getting messaging out to our parents as well as to friends and families and neighbors of our parents, so that we can get our numbers to a place where we know that we're in good shape as we get counted in the Permian. I want to thank you for being with us today.
Thank you so very much for having me.
Brad, yes, thank you. We'll be glad to get those.
I got to turn my microphone on. We now turn to public forum. We have 3 individuals who have signed up to visit with us this evening. I'll read their names also. They'll know the order that we're going to call them. First, we have Matt Galindo. Next, Kristen Vargas. And then finally, Katie Joyner. So each of you, we will call you in that order. You each have 3 minutes to address the board. And then Mr. Murray, who is our secretary, if you hear a beep beep, that means your 3 minutes is up. If you'll please stop there. So we'll first call Mr. Galindo.
Eight 1 4 9 5 9 is.
All right, we got a voicemail, so we will double back to him before we conclude public forum, but we'll go to speaker number 2, which is Kristen Vargas. Calling Ms. Vargas now. Ms. Vargas?
Do you mean Ms. Vasquez?
Well, I'm sorry. It's on my typed written list here. It's Vargas, but Kristen Vasquez, is that Ms. Vasquez? Is that you?
Yes, it is.
All right. Well, welcome. You've signed up for the topic, Virtual Online Academy, right?
Yes.
All right. Well, you have the floor for the next 3 minutes. Welcome.
Thank you. I really need some clarification why the community was presented the Virtual Online Academy as an option for students and teachers before finding out from the state if it was a legal option. We were told in June that if teachers felt uncomfortable physically being in a classroom, that the virtual academy was an option for them. But if they wanted to remain in class, that they could also. And yet now teachers are being told that they have to simultaneously create content for the virtual online academy, as well as for their students that will return in person, which right now it looks exactly the same, but that's not going to be the case when in-person teaching resumes. How can you possibly expect teachers to give 100% to both virtual academy and in-person instruction? We already learned how hard virtual instruction is. Since you're giving them double the workload, are you going to double their pay? At what point do our teachers stop suffering the consequences of poor planning from our districts? We already did them a huge disservice by not giving them a heads up before August 3rd that they would be going back virtually for the first 4 weeks. Every bit of lesson planning that they worked on over the summer is now scrapped and has to be converted to online. And I've heard from so many teachers that are spending so much of their own money to pay for online curriculum, and this is wrong. If this is the example of what our leadership looks like, and if we can't expect our leaders to do their due diligence when presenting our community with options like this, then this is what needs to be taken into consideration when we're evaluating our superintendent's contract. Y'all have got to start taking better care of your teachers because this is not fair to them. Thank you.
All right, thank you, Ms. Vasquez. Mr. Riddick, are we going to cover this in the district reports, or did you
It will be. It will be covered during the reentry, but I can certainly speak to it right now.
Okay, go ahead.
So one, it's misinformation that the classroom teacher would also be doing the classroom instruction as well as the online academy. We don't expect our teachers to be doubling in that capacity, and we knew this. So we have our online enrollment, which I believe is about 3,600 students at this point in time. When we leave the platform for 100% online, we will have online assigned teachers and we'll have classroom assigned teachers. We'll go into a blended phased model, which Dr. Atkins will speak to here in a moment. I'm disappointed that that's information that is out there, that we would ask teachers to deliver that way in regards to fulfilling both the obligations in regards to the online academy, as well as into our brick and mortar, which would be our blended face-to-face. There is an online component assigned into the brick and mortar. That's half your students are going to be with you. Your other half the students will be in their virtual platform in a flipped classroom. And then they will come and get their face-to-face while the others go out into their flipped classroom and into the virtual. But to do the online academy in the brick and mortar is not the case. And you'll get more information as we get into our presentation during our district reports.
All right, so if you're a teacher that signed up to be a virtual online academy teacher, you will not have in-classroom responsibilities.
Correct.
That's correct?
That's correct.
Okay, and you won't have any, in a hybrid situation, you won't have, that classroom teacher won't have any virtual online academy responsibilities, but they will have their classroom responsibilities for the virtual learners.
Correct.
But not the academy responsibilities.
Correct.
Okay. All right. Thank you. All right. Next, we will call Katie Joyner. The topic is petition for in-person learning option. Calling Ms. Joyner now.
All right, next, we will call Katie Joyner.
Ms. Joyner?
Hi.
Calling
Yeah,
Ms. Joyner now.
if you could please maybe turn down the volume on
Can
your
you-
device, and that we won't get feedback. But once you do that, then you have the floor for the next 3 minutes to address us on the petition for in-person learning option. Welcome.
Great, thank you. Is this okay now? Is
Yeah.
it sounding okay on y'all's end? Okay.
That's great. No feedback. Thank you.
Okay, thanks. Good evening, trustees and Mr. Riddick. I would like to say, according to the American Association of Pediatrics, aka the AAP, quote, school policies should be guided by supporting the overall health and well-being of all children, adolescents, their families, and their communities. With the above principle in mind, the AAP strongly advocates that all policy considerations for the coming school year should start with the goal of having students physically present in school, end quote. As you may be aware, upon learning of the MISD administration's decision to have the first 4 weeks of the school year be fully virtual, I started a petition stating that an in-person option for school should be offered after the 4 weeks of virtual learning is over. At this moment, after only 9 days of being live, it has garnered 1,191 signatures. It helps to demonstrate the need and support for our schools to reopen. This petition was a completely grassroots-led effort and has given our community a constructive place to have their voices heard. I'm aware that many families in our community aren't ready for their children to return to school in person, and I applaud the district for offering the online academy in order to meet that need. However, there is currently no option offered by the district for those families who need help supervising the learning of their children during the school day. There are options offered by the district and third parties for a fee, but I see two things wrong with that. First, if those children can safely gather for right at school and at the YMCA, why can't they gather in a traditional class setting? Second, the additional financial strain of paying for these services during the worst financial collapse our country and community have seen since the Great Depression are crippling for many. We have all lived through the trauma of COVID, and we recognize that there are no easy answers. We are not asking for daycare. We are asking for the best educational options for our educators and children. We must begin proactively preparing for the return to our taxpayer-funded buildings, and the administration should be sharing information promptly along the way, starting with a clear empirical system of threat assessment on which the administration bases its decisions, and the exact data being used and updated frequently. With clearly stated CDC recommended safety precautions in place and a clear vision for in-person learning, I believe MISD can reopen successfully and allow families to choose what's best for their child. Again, we applaud the efforts made to create an online option, but the goal must be to return to the classroom for those that need and want to be back on campus as soon as possible. Lastly, in light of the recent op-ed penned by Mr. Riddick and Mr. Myers on Sunday, it appears that the district is indeed listening to our plea, and I implore you to keep an open dialogue with the community about your plans to offer in-person learning. Thank you for your time.
All right, thank you, Ms. Joyner. All right, now we will double back to Mr. Glendo, give him a second chance. Calling Mr. Glendo now. Mr. Galindo?
Yes, how you doing?
Hi, I've got the topic is superintendent evaluation. Is that correct?
Yes, sir. I had just had a question.
You have the floor for the next 3 minutes to address this. Welcome.
All right, thank you. Well, I just wanted to address the superintendent evaluation. There's some questions regarding on how he was going to be evaluated, and I know that in the email that I sent you, Mr. Davis, you responded and said that that was confidential, as are all evaluations. It's personal. But I wanted to share some information, and this is information that can be found on the MISD website. It states that the board shall evaluate the superintendent on the district's achievement of the board's student outcome goals and in compliance with the superintendent's constraints, accomplishment of at least 80% of these adopted progress measures, goal progress measures, and constraint measures. Annual targets shall be the automatic indicator of success. Below that threshold, the board shall use their judgment and be the indicator of success. When I spoke to another board member, and I'm not sure if they're still evaluating the superintendent on that or not, or if it's changed to the Lone Star governance. Either way, I just wanted to share these reports that are from December of 2019 to April, of 2020. Percentage of students in 3rd to 8th grade on track to meeting the passing standard on both reading and math district checkpoints. The target is 75%. In March of 2020, we hit 45%. The percentage of economically disadvantaged students in 3rd to 8th grade on track to meeting the passing standards on both reading and math district checkpoints. The target is 70%. February to March 2020, we hit 37%. The percentage of 3rd to 8th graders achieving the master's level performance on reading and math district checkpoints. The target is 15%. In February and March of 2020, we hit 5%. Vocal progress measure 1.1, the percentage of students in kindergarten through the second grade who are reading on or above grade level in iStation Espanol will increase from 57% to 85% at the end of the 2020 year. The goal was 85%. We hit mid-year at 60%, 3% lower than the year before. Percentage of students reading on or above grade level in phonics and Pinel. For K through 2, the goal is 85%. Mid-year of 2020, we hit 65%. Percentage of students enrolled in the F-rated campus. In 2016, 2017, we were at 21%. We dropped down in 18 and 10%. 19, we were at 9% and jumped right back up to 19% at the end of at 2020. But it's not all negative. GPM 3.1, the percentage of first-time ninth graders on track to earn Algebra 1 credits. Goal was 91%. We hit 90%. GPM 3.2, percentage of students in the ninth grade. Either way, what I want to say. Well, what I want to say, gentlemen, is we're not expecting perfection, but we are expecting progress, and I hope that you're able to hold this superintendent accountable on the lack of progress made in this district. Thank you.
All right, Mr. Galindo. Thank you. That concludes our three speakers that have signed to address us during public forum. So we will now move to our consent agenda items. 4A, board meeting minutes, which appear on page 19 of the meeting packet. 4B, monthly financials, page 33. 4C, monthly expenditures, page 45. 4D, monthly investment report, page 54. 4E, request for qualifications, special education professional services, page 61. Request for qualifications, request to change broker of record, property insurance, page 64. 4G, personnel appointments, page 72. 4H, update to FMG local, page 79. TASB policy update 115, page 117. And 4J, resolution of the board regarding extension of leave during precautionary exclusion, page 136. Board members, do any of these items need to be pulled from the consent agenda for any reason? H, which is the update to FMG local. Is that correct?
Yes, sir.
All right. Any others? All right. Then consent agenda items 4A, B, C, D, E, F, G, I, and J will be deemed approved by consent. Now returning back to consent agenda item 4H, update to FMG local on page 79 of our meeting packet.
So Mr. Marquez and Mr. Fuller and myself are on the policy committee, and we had a meeting with staff, including the attorney and Mr. Horner. I thought this one was pertinent for the board to have an update for Mr. Horner just briefly, because it directly affects kind of the coming year, field trips, kind of in what's going on in the COVID world. And so want Mr. Horner to kind of update the full board.
Right,
yes,
Mr. Horner, welcome.
Thank you, President Davis, Superintendent Riddick, trustees. Just a quick note about FMG local. So going through the COVID preparation, getting ready for opening of school, one of Mr. Riddick's task force with extracurricular activities brought a review of FMG local. FMG local is very specific to what we allow, don't allow for student travel. In review, we initially wanted to go in and make changes so we could give more flexibility to campuses. Right now, our policy pretty much, when we travel, we travel on a school district bus, a school vehicle. But because COVID safety precautions would pretty much double the number of students that we would have to put on buses, it was presented to have an opportunity for within Midland for students that licensed drivers to actually drive themselves. An example would be a football player getting to Grande Stadium they actually might get there on their own rather than getting on the bus at Lee High School or Midland High School and traveling to Grande. So in short, we brought this to the committee, the policy committee last week, presented the field trip manual. Field trip manual, we have made the decision not to have any field trips locally or in-state or out-of-state the full first semester, and no out-of-state or out-of-country the full year, or excuse me, no out-of-country the full year, and we would review that again at Christmas time. After TASB Council reviewed the policy, they actually recommended, rather than the slight change that we had talked to the committee about, but actually to pull the entire FMG local and delete it, as per Lone Star governance, trying to minimize the amount of policies to monitor and address. That was TASB's recommendation. They do not recommend that student travel of any form be actually in policy. So it is our recommendation based on that and based on the safety committee's input that we remove FMG local and use administrative regs, which you have a copy of there, the field trip manual, and the details, much more in detail than what I described for our regulations on how we would handle travel.
Do we have an idea of what other districts are doing similarly with football season coming? We know the team's going to go, but you know, are parents going to go? Band, cheerleaders? Do we know? Is that a district by district decision? Are we going to allow opposing teams? Or are we going to?
Mr. Riddick, so right now, our district executive committee, which is the 26A committee that oversees all of our in-district competition, have been meeting. We are going to put forth one decision that all of us are going to abide by. Initial conversations will be, we'll have social distancing in events. We'll have definitely the opportunity for parents to attend. More than likely, that will be limited on the number of tickets. We'll prioritize parents first. More than likely, our band, our cheerleaders, our folks will be at our games, but we will not travel at all to out-of-town games other than the teams themselves participating. So the DEC is working through that. It should be finalized plenty of time before the first events in late September.
Most of the schedule is just district. They're playing a district schedule, but there are a couple, like I think Midland High goes to Wichita Falls. They're not in our district, so their policy may be different. Do we know if parents are going to be able to go? Cheerleaders, band? Is a conversation we've had? They've made that decision. They haven't.
Stadiums. So stadiums always have, and gymnasiums always have the ability to create their own criteria. And so, if our volleyball teams are traveling to Wichita Falls, they'll tell us in advance what their entry policy will be, and we'll make sure to communicate that out to our parents well in advance.
Are there broad guidelines that have been established between the respective ISDs?
So the question is, are there broad guidelines? Let me know if I didn't get that right. Are there broad guidelines established between the districts? Did I get that right, Mr. Fuller? Did I? So the answer is within our 26A, absolutely. Each DEC committee has some flexibility to make some different decisions. All of us are operating by what UIL and governor's orders have already put out. So the broad guidelines have been established. They are very broad and not real detail. But I would expect that, and I know this, our district committee, Blake Felt's really leading that work for us. They're working, our DEC is working to be in line with what other DECs are also doing. So I don't expect that we'll be out of the ordinary of what the state of Texas is doing with these. Now, with that said, when we get to going to an event at, say it's the Wichita Falls Athletic Complex that is controlled by that individual, they have that authority to set that criteria. So we don't necessarily have the ability to always be exactly in line, but the general consensus that we're hearing right now is we're only sending competing students, and first priority for spectators will always be parents, and social distancing within stands in those parents. The other part is UIL for the first time ever has agreed to live stream every event. So we will be live streaming all UIL events where we didn't used to do that with the actual video and everything to go with it.
Motion by Mr. Trischetti, second by Mr. Fuller. Any further questions or discussion? All those in favor, please raise your right hand, and I need to see Mr. Kennedy's screen, please.
Can you not see me?
Well, you weren't up on our screen. We're pulling you up now. Now I see your hand, so it is unanimous. Thank you.
Thank you.
Motion passes. All right, next is our district reports, agenda item 5A, our chief of staff update. The information begins on page 139 of the meeting packet. Dr. Atkins, welcome.
Good evening, President Davis, Superintendent Riddick, Board of Trustees. I'm here tonight to talk to you a little bit more about where we are right now with our fall 2020 reentry plan, and also some of our next steps that we have planned moving forward. There we go. Okay, so as you know, at this point in time, Midland ISD will be moving towards an online at-home learning model. This is a temporary model that we will be basing upon moving forward into the next school year. It's not intended to be a permanent solution, but rather a short-term response to a number of factors, including the information we received from our health officials, our local and state officials. At the time of determination, we're looking at the positivity rates and also looking at our staff surveys. And I'll talk to you a little bit more about what further on what we saw with those moving into that. This was not something that we entered into lightly. It was something that we had to look at multiple measures. And I think that's one of the questions that does sit out there right now is what are the metrics that are utilized to do this? So Midland ISD does not set the metrics for COVID spread. Rather, it's important for us to consult with our local health authorities in determining that. And so as we've done so, and as we entered into this decision, we looked at a number of factors that are and conversations we had with our hospitals regarding positivity rate, hospitalizations, and deaths. And so one thing that we did find and that was shared with us was that the hospitalizations related to COVID, while they have decreased, they have stabilized. What's important to understand about stabilized is that means it has not continued to go down. So we're continuing to have conversations with our hospital around that. Also considering that we've not had a situation where we've had a large number of students or even half the number of students that we have in Midland ISD all together in one place. We have to understand what this could do to our community mitigation efforts that we feel that have been successful. I know in a recent hospital briefing, it was shared with us that we are starting to see some downward trends, which would be very optimistic. We want to make sure that we are entering into this in the most mindful way possible. At the same time, we realize and we have to acknowledge that there are different perspectives on all of these measures as well. And so we understand that. So when we looked at this, we did look at our staff feedback surveys that we did launch over the summer, and this one's most recently in July. You see there we have 65.2% in support of starting an in-person option and transitioning to, I said that backwards, a virtual launch with in-person later on. And that was based upon our staff survey in July. We also surveyed our students' interests and our families' interests in virtual learning, and you can see there 50.6% were interested. We've also engaged a number of focus groups, and in our most recent focus group, including elementary and secondary teachers, elementary and secondary parents, they've engaged in a number of conversations, and I apologize that it is very light right there. You can see 50% said that yes, Midland ISD should utilize the at-home learning model. 22.8 we're not sure, and 27.2 said no. These focus groups have been very data-driven and focused and collaborative in looking at data, looking at where some of the trends are, and that was what we also saw from our focus group feedback. So hence the at-home instruction model intended for, initially stated for 4 weeks. 4 weeks was the number of weeks that TEA initially allotted us in order to provide a virtual opportunity, 100% virtual opportunity, and start off in that way. And I know you've seen this slide before. One thing that is important to highlight here, though, is that this is Midland ISD curriculum being taught by Midland ISD teachers in a virtual format. We've worked very closely with our technology departments to make sure that we have Chromebooks, we have Wi-Fi hotspots delivered to students who need them, so that we can make sure our students do have those resources and those tools to engage in their academics.
Can we pause right here for a second?
Yes, sir.
So the deadline for signing up for the academy, those that want to do that full first 6 weeks, because once you're in, you got to stay a grading period.
Correct.
So that'll
some outliers around.
sure. And there were thousands, correct, that signed up, 6,000 or something.
3,600 today.
3,600.
Correct. 3,600 signed for the online.
So with 7,000 students, better than 10%. My math right there?
Yep.
Yeah. Okay. So I guess for me, I understand that we don't open the floodgates and have everyone come back in person. Get it. If we have a percentage that are going to probably opt out for the virtual, for the academy model, and then we can do some phase blending and even do a Monday, Wednesday, Tuesday, Thursday cohort, do we still feel that the 4 week is, or we do a pre-K through 2 and special needs and students of staffers? I mean, whatever that looks, however you mix those ingredients together to just begin to give the community some, we are, getting these kids back on campus.
That's a good question. And
that was a question I was going to ask.
Yeah.
I was going to wait to the end.
And I think in the presentation, you'll see how we're
Okay, I'm sorry.
address that.
It just, that specifically said the phase blended, and so that's where it peaked for me. I'm
And
sorry.
so,
Go ahead, Dr. Atkins.
That was our original intent, was to go to a blended model and begin with that.
Right.
As we start to look at, as we're immersed in the conversation with our healthcare consultants around what it looks like around the metrics that are being used to describe COVID, we're now going to be looking at what potentially could be another model that we can move into, as well as how soon can we move into it. So we set a 4 week marking point to say, if we see the things that we need to see in regards to where the data is going, we can emerge into a phased model within the blended model.
Okay.
And I think you'll see some of this here in a moment.
All right. Sorry, Dr. Atkins.
No worries. And so we want to move forward in a cautious approach and in an informed approach, as what Superintendent Riddick was sharing. So this could occur before the 4 weeks at home period is concluded, or that was announced. Regardless of what happens, though, regardless of what model the district shifts to, we understand and we're sensitive to the fact that there are families that will continue to wish for an online, 100% online model for their students, and that is another opportunity, the Midland ISD Online Academy, taught by specific teachers dedicated to that purpose.
Which is great. Don't hear me that I'm knocking the virtual option. I love it. I just feel like it doesn't go, and you may get there, but it doesn't go both. If you have the in-person, but you can virtual option, I feel like we're kind of saying the virtual option, but people can't opt into the in-person. You know what I mean?
Right.
It's, okay, go ahead.
So as we move towards taking our next steps really have to be informed with our conversations with our hospital.
Okay.
And with our medical professionals. So for example, a phase-in approach would be a cautious transition. It could look something like where we have phase 1 being pre-K3 and life skills students coming back. Then we can move into phase 2, the remainder of our elementary students. Phase 3, junior high. Phase 4, our high school. So that would get us into a blended approach, maybe at an earlier time than what we originally shared. It depends upon our conversations with our hospitals and where our community spread is and what those metrics, what those are indicating.
And so when you talk, you may, if I don't ask what I'm thinking about, I'm gonna lose it. So are there defined timelines for the phases, or is that when you're talking about in conjunction with talking with healthcare professionals? It could be except you could have phase 1 after Labor Day, which would be before your 4 weeks is up, based upon the data and metrics that we're seeing.
Exactly. We're going to have to continue to monitor and being able to put a predetermined amount of time. We would love to do that because then we can plan and be super solid on that. But it really requires us to have very informed conversations and continue to monitor and adjust and respond accordingly.
Okay.
So next steps, I think that's where everybody is headed towards. What are the next steps to determine the instructional model following the at-home learning model? Again, close consultation with our authorities, our local health authorities. That's really where this lies. We're going to continue to stay in close conversations with them and make sure that we are doing the best by our students and by our staff and by our community. We also continue to look at our number of our students and our families and our staff who have tested COVID positive. So there are a number of factors that do move into that, but we continue to support to make that available at those websites that you see there. And so that is moving towards our next steps. We really want to get our kids back to an in-person situation. Our teachers want to be back in person teaching. They've shared with us also that they want to do it safely, and that's what we're committed to doing. At this point, I'll take any further questions we might have.
I guess I have a couple questions. One is, I know it was said and talked about that there was 2 different numbers between, I guess, the city and the hospital based on where the real numbers were. So I think there was some misunderstanding. So I guess one of the questions I asked, where is the true number live? Is it within the city or the hospital? And I guess another question on top of that is, how is it being reported to try to get the accuracy of the number? So not only that we as a school district know, but as far as the parents and the community know where we are as far as our numbers. That's a question within itself. But then are we aligned with our crosstown rivals as far as the way every county is reporting? I know it's an outside entity, but they're same, if not a little bit larger school district than what we are, but they've already started having kids report to school. And I don't know if it's based on the survey that they received from their teachers and community based on ours, to try to have to be in line with each other to see on the way of getting kids back to school in a safe manner.
So to start with your most recent question, and I'll backtrack and hopefully I can get to all the others, and Dr. Gaskins can share in there as well. Ector County is doing a phased model. They started with their 3-year-olds, special needs students who needed wireless, and everyone else was going to be virtual at that point. So they're going to stay in that footprint as long as their data trend. They'll then begin an integration of all the other students that want the face-to-face from the all virtual back into the face-to-face environment. That speaks to what we were looking at doing in our phase blended model. Our phase blended model had a pre-K3 and life skills special needs students. Those students we see every day. We would begin with that student population, and as things optimistically, if they trend in the direction we need them to trend, we would then open it up for everyone else, and we would not open and then try to close and go back. So we try to stick with that footprint and then move forward. And our counterparts in Odessa are doing very similar. As their trends stay, they won't introduce any more people into their campuses until they start to see the trend lines start to occur, either bending or flattening within those metrics. Can't speak to how Odessa is using their consultation within the health industry that they're surrounded by. I can just share for us as we are gathering our data and information. I believe at that point there may have been 3 dashboards that were out there. We were using the city's dashboard in order to aggregate our information, because that's what the city does. It takes information from the hospital and every other provider that is in our city that's doing any type of testing, and it pulls all that together. During a time frame, may have been late July, the state went to a new program for processing what those numbers look like. And the city at that point in time, their numbers were lagging. We did not know their numbers were lagging, but their numbers were lagging by about 4 days. We were getting information from the hospital, which hospital contains and does just their own, so that we can help keep ourselves informed along the way. So going between the two. Now, in a conversation between the city, the hospital, we have agreed that there will be one reporting entity that gives us that keeps that information on track for our community, so our community can know what that looks like. There are a couple other questions. I'm not sure if I'm getting to them.
No, thank you. Thank you.
And I'll let Dr. Askins fill in any gaps that I may have left out if there were any.
So the one of the it's not the million, it's $1 billion question, but apparently everybody, there's a lot. Seems like we have a lot of experts in the COVID field now. But the thing that the problem is that where are we teetering, and where does the hospital say? Because that's the only service in town that's going to protect you. I mean, that's the only one that's going to keep you alive when it hits you. I mean, that's the only place here currently that we have. So where is that number? I mean, how many people how fast can that go and we can sustain an opening? I mean, I know that's a difficult question to ask, but where can we sustain an opening? And then we got children, parents, teachers, because I've heard of some sad stories here lately, especially in Hidalgo County in South Texas. But I talked to a nurse professional, and she told me she was offered $25,000 to go work for 9 days. And she's like, yeah, maybe not. My health and my life is worth slightly little more. And I was like, man, I was impressed at how much money, someone's willing to pay for services right now. And so the question is, how fast can we open and bring that number up? And then how does because the only service we have is currently the hospital here, the medical, and then the emergency cares that we have. How fast do they think they can handle an outbreak? Because it will be caused by the gathering of people and the lack of social distancing. I mean, there's no doubt about it. The current example across the entire United States of America has been the fact that we don't have a shot yet. Second, the no social distancing is bringing about outbreaks. And, I struggle with this every day. I want some kids sitting at a house. No, that's not my objective. My objective is to have kids and learning and education. But where does the hospital say, hey, if you open and bring this many people in and we get to this number, how bad is that going to be? Is there like a number out there?
Well, the hospital has a number of ventilators. Hospital has a number of beds that they can bring individuals into. And there is a number. I don't know that number without looking at their dashboard, but they do have what that number looks like. Dr. Wilson during this time spoke to us about vectoring and about congregation and what that could mean, because that does have a direct impact to what you're speaking to. And how, he appreciated how we were creating a cautious plan as we move forward, because that is a direct impact for our entire community, much like what you're speaking to. But the hospital does have those numbers. We early on, back in March, set up a school that we could put together that could service the hospital, not just with where could they put extra beds, but also where could we house staff and others in proximity to the hospital, almost like a MASH unit. So we look to say we're available this way. We've been partners like this from the very beginning. Now we're leaning on the hospital as we get to this stage where the hospital may have leaned in a little towards us at the very beginning. And so it's a, we're in a learning process. Right. No one today can tell me, when we put up our dashboard, and I think there was a reference to, the community wants information, and I want to give community information. And Mr. Davis asked me this question just the other day, as a matter of fact, that no one's telling me what low, medium, and high means, right? As far as our dashboard that we have that says when we're high, this is what we need to really think about. The CDC has given a guidance on 5% with 14 days of decreasing. So 5% positivity rate, 14 days of decreasing, that gives you a window to open. I received an email, not a very pleasant one, from someone who shared about New York. Well, New York is at 1%. So they are clearly below the 5% and ready to open. Well, when we were making our decision, the two dashboards that we were using, hospital was at 23.9 and the city was at 21.3. Clearly well ahead of 1%. So now we're trying to make decisions on what do we need to do in order to make best decisions for our community that could really make an impact in a lot of different ways. And we know it hurts. Trust me, I know it hurts. I was raised by a single mom. I know the pain. I know the agony. I have staff members that are single parents. I have staff members that are both working households. And it is not what we want to do. It's not in our nature. But we've got to think through all the moving parts around this, because you bring a broader question that comes forward. And, and we are, fortunately, I have a great relationship with the leadership within the hospital. I lean into him to help guide, as well as their team members who speak specifically to what is occurring around COVID. We're seeing some positive trends. We've got to keep doing things. We've got to keep social distancing, like this meeting. We've got to put some other practices in place. Cleaning your hands still work. We're coming into the flu season. These things still help us when we're in the flu season, so that we can get to a point where we can start to bring kiddos back, so we can get a point where we're back where we were previously. It's some challenges built into it, but we can get there. So we have a phased plan that will at least help us start to see some of that direction.
And so I've seen some of the I've been emailed and seen some of the comments about, why don't we open, but there's already examples after example across the United States of America. They opened up a school district and they had to close it again. You got 20 or 30 or 40 people already with COVID. I don't know. I know we shared some information. I don't know how deep we can share information about how our staff is getting affected by COVID. But I think that would be a helpful resource to the community to let the people know that our staff, that our teachers and bus drivers and staff that works in the cleaning and everybody, they're not bulletproof. These are human beings that can be affected and, ultimately could have a bad outcome from being infected from this terrible disease. And I know, like I said, I see the struggle across the country in the state with people opening up, having to close down. And I think one of the main purposes for a school board and a trustee is to seek the safety of children at all costs. As much as science and intelligence will allow us to get there, I think the safety of children is a high priority. So, I'm the one that if we missed it by a bit and we're wrong on the opening, and kids didn't get, we weren't the cause of the outbreak. You know, with the current information and science that's out there, my brain tells me to lean on the safety side. You know, and you know, I express this because this is a hard decision. This is a hard decision to go to sleep every night, having people email you that you're not doing the right thing for the community, and that's not the case. You know, I see my own grandchildren, and I don't want to say, "Hey, I'm willing to sacrifice that one to send them to school." You know, I just can't do that. I can't look at my own grandchildren and say, "I'm going to sacrifice you so we can prove a point and send you back to school." You know, and those are tough decisions. And to me, I would ask patience from the community. You know, it's been expressed in a lot of other meetings I've had that are not school related, but you know, patience would help a bunch during this time. I'm saying till we get that vaccine and people start getting it starts going around, it's going to be a tough going. I mean, I don't know what else to say that would supply good information for a district. I just don't know. I mean, I'm at wit's end about how you go out there and figure out that we're going to do the perfect right thing for the public and for all the students that go to our district. I mean, and I know I'm ranting on here, but I appreciate the information. I appreciate the calculation of holding back, you know, and supplying as much information to our public. But this is not something that we can get wrong. I mean, it just, this is very serious. So.
Thank you, Trustee Marquez. You shared a wondering earlier about the number of staff members in Midland ISD, of our own staff members who have been who have contracted COVID during even the summer months. So we do make that available on our COVID-19 dashboard. If you go to midlandisd.net/fall2020, anyone in the community can go to that website and see what our Midland ISD COVID-19 dashboard is. I want to specify that is not a citywide dashboard. That is just a reporting of the number of COVID positive cases we've had within our own school district during this time, even without students. So we certainly welcome people to look at that should they have wonderings on that as well. Yes, sir.
Part of it is that, I'm sorry, Mr. Fuller, just real quick, that we'll be doing unified briefings so that we have an opportunity for city, hospital, district like we did back in the spring. So our community is informed. I know we started that, we leaned away from it. Everybody went in their separate ways, thus the number of dashboards that we've seen now coming back together. So we do it in a very unified way for our community to understand.
Would it be possible to add information like, I'm just speaking out loud, but would it be possible to add information about how long these people are taking to get over the COVID? Because it's not exactly you get it, you wait 14 days and you're done with it. I've been told by doctors that it takes your body, and everybody's different, but it takes your body a lot more to heal up internally than the 14 days that you've gone through the incubation period. So, I mean, because that would be helpful to, I think, the community to know that the people that have been affected don't just wait the 14 days and then, you know, they're hunky-dory and they're back to work. And, you know, there could be people that are struggling for a month or two, still trying to get over the illness. So I think that would be helpful to people to know that it's just not a 14-day incubation period and you're over with it and you just move on.
My staff shares that, although very insightful, that there are so many variables that go into play. You know, what underlying conditions someone might have that changes the variable for every staff member that this poses a threat.
Yes, sir, Mr. Fulton.
You were mentioning the flu. Will the flu season alter your strategies or cause you to possibly change your approach to dealing with the flu, and COVID?
So with the flu, I mean, one thing we know, flu is certainly something to be, mindful of and concerned about. One difference that we do see with flu versus COVID, flu, there is a vaccine. Sometimes it works, sometimes it doesn't. COVID, there is none. And as to Mr. Marquez's point earlier, the implications of COVID, it varies from person to person. And we're just now starting to see that it can be very difficult to get over. I think considering the flu season, again, that's another conversation that we'll continue to have with our hospitals, because that's another layer to add upon considerations as we move forward.
That conversation hasn't begun?
It's continuing conversations.
And it's fortunate through our information with the hospital and their ability to help us. We know we're going to be battling two things this fall, flu and COVID. The things that we do to mitigate COVID is going to help with the flu as well. And so we've had our first early flu case here in Midland. So getting the vaccine certainly is one of the things to help, so that if something does occur with the flu, your symptoms are reduced tremendously. But what we do for disinfecting, what we do for social distancing, what we do to wear masks, the things that we're doing for UV lighting to disinfect rooms, all those things will help for both of those concerns that we have forward. But both those two storms are coming.
Okay, I want to ask this, and I'm going to limit my questions because of the time we've spent, but do you know what the COVID rate, or the positivity rate is today? Because my understanding was that 21.3 wasn't inaccurate on August 3rd. It was 4 days behind. So do we know what it is today?
So that's one thing that we have that has been shared with us throughout this time, is that because of the change of systems that they had to, that the hospital, that all health entities had to switch to via the state of Texas, that it was lagging. And I believe that we still see some of those lagging numbers from those entities.
So the infectious disease person with the hospital gives us an update on what the hospital's positivity rate is. Showed a decline on that day when we were making a decision. It was 23.9. She has shown that there is a decline around what that looks like, which is a positive indicator. We've had several days of what that looks like.
Do you know the
testing,
number?
I don't have it today. I'll look at my phone in just a moment, but I have it from the other day that she did send that to Jean Douglas, our Director of Nursing and Health Services. I can give that to you in just a moment. The city updating their website, their dashboard, not gone into it for a couple of days now, but waiting for that dashboard to be updated. It's been done so recently. Jean will text me here in just a moment to let me know.
And so while I agree with what Mr. Marquez said about the safety of our students being the utmost priority, followed right secondly with our teachers, I agree with what Mr. Trischetti said, is that we've given the option of online school for those parents that want it. And in my opinion, I think the parents of these students, not the school board, ought to be making the decision whether they want their kids in school. And so if we have to have them sign a waiver or whatever it is that we move in that direction, I agree with us having this phase in sooner rather than later, especially the K through 3 and the special needs students, and having those students on campus quicker than later. And so I'm not sure how the death rate really affects us, because what the things I see, it's all an elderly type scenario that's responsible for deaths. I would like to know what the infection rate is for 16 and below, and the death rate for 16 and below, because I don't think that's very high.
Don't have the, and I'm sure that the data is out there on the death rate for our 19 and below. Back in March, it was one student we were dealing with, and we went to closure when it was one student during that time. It had jumped up as high as 144. Don't have what the latest number is.
Is that nationwide?
No, in our area.
Okay.
Had gone up to 144. As of
144 students had died?
No, not died. Positive.
Oh, okay.
19 and it's 19 and under.
Okay.
Is a ratio that the city uses when they create their bar graphs. So we started looking at what 0 to 19 looks like. We started looking at 20 to 40. We have 800 teachers who are in that age group. So early on, that group was not impacted. It was the 60 plus. We have 300 teachers who are in the 60 plus region, which were, as we were learning, was an area of concern for us. Then it switched. That was in the spring. Then it flip-flopped. It became the 20 to 40 was the high area of concern, and the 60 plus was not had done a lot of work. We had done a lot of work to mitigate what that looked like for the 60 plus. And so the 20 to 40 became the range, and that's the 800 just teachers in that area. So as of 8/15, the hospital was at 12%, which is what they last reported for us. So we know that we're seeing what that number is looking like for the hospital. The city has updated as of August the 9th. So you see some lagging there, was at 20%. And so we're seeing some indicators that are, which Dr. Atkins talked about, stabilizing, and we're seeing some start to trend, hospitals start to trend. So we're gathering that information for us to make that decision on what is the phase blended model. I appreciate the fact that you appreciate that. I like the fact that you appreciate it. When we can enter into that model for our pre-K 3 and our special needs students. And that would be an everyday with that group of kiddos.
Sure. What's the answer to the question of, and I'm asking genuinely, it's been asked of me and I don't feel like I had a great answer of, if it's safe enough for right at school to happen at school facilities, why is it not safe enough to do a phased? Again, I get we're not sending every kid back to campus, But.
So one thing that we've done, we've even operated this summer with Right at School as an opportunity for childcare. We're extending that opportunity because we know that it will leave some in a lurch, and we don't want that to be the case. But they are operating under some very small ratios, and so that's one thing that we're being very strategic in, is making sure that we have Right at School. I think right now it's at 2 campuses. If we need to expand further, then we certainly will do that. But it's much different to have that sort of situation as a childcare opportunity rather than to bring all students into the building or a subgroup of students back into the building at that point in time.
Does the current phase 1 plan, let's say it moves forward, given the trending, and is it, because the original conversation several weeks ago was when pre-K through 2nd or 3rd go back, they're going 5 days a week. Is that still, or are they going to cohort out and do a?
No,
they would come.
That's what we would like to do.
It would be everyone else that we would build in a A-Day, B-Day model, or cohort model.
Okay.
We had committed that group, and we understand from our community as well. It's our work that is a very vulnerable group.
Yes.
And we do need those kiddos, and we do need them every day. That we need to build a model and a plan for those kiddos every day.
Okay. I'm sorry.
I guess two questions. One is, I think the major concern, from a standpoint of the community, and I understand the school stance on it. I know there's single parents, as Mr. Shetty spoke on. There's single parents that are burdened by even trying to send their child to Right at School because of the cost, for one. And then I guess the second question would be is, again, have we, since Ector County has started, Mr. Riddick or Dr. Atkins, do y'all know if they've had any reported cases of any students since school has started?
So
the model that they're in?
They're very limited, right? They're not even doing pre-K through 2nd or 3rd.
They're doing their 3rd. They're doing students who need Wi-Fi and special needs.
They're doing pre-K 3-year-old. You said 3rd.
Excuse me. Yes,
Yeah.
pre-K. They're doing 3-year-olds.
Yes.
They're 3-year-old centers. Yes,
So, I mean,
they've had positive at the adult and student level. We know that that's going to occur and happen, but they have. I'm sorry, Mr. Bishop, I missed your question before that one.
Well, and then the first one was, I know we have single parents and both and married as well, where it puts a strain on them, on those families, even more financially if they're accustomed to their kids being at school than trying to go to right at school and having to pay that cost
Correct.
as well.
So there'll be a form that parents can go and complete, where there'll be a contact that they'll reach out to, that will reach back out to them, that if there is a hardship that's built around this, let us know. And we will work with that parent and that family to help them. Our goal is not to, hinder and hurt families. It's not what we want to do. So there'll be a form on the Right at School registration page where a parent can go in there based on their hardship, complete the form. We'll have follow-up questions that we'll be asking this parent, and then we'll reach back out to the parent with whatever need that we will be able to address for them. Because it is a hardship. You have several kids that you're working through. We'll get to a point where we can get kids back in.
You said that we had 2 Right at School campuses currently. How many students approximately do we have?
I just got the update just the other day.
It was around, I think, between 65 and 70 had enrolled.
So for the all day, there was about 60 kids that needed the all day. And then we have 2 half-day options, a morning half-day and an afternoon half-day. And there may have been 50 some odd kids who were enrolled in those options. So, and their ratio's a 1 to 9 ratio.
50 each half day or 50 cumulatively for?
I think it was, I believe,
roughly.
I don't want to answer that without looking. I see the bar graph and charts. I don't know if it was 30 and 30 or 60 and 60, but I don't believe those numbers were as high as 200, which would put me at 60, 60, and 60, put me in that range. I don't recall seeing it that high. I recall about 120 kids, roughly.
Now all daycares in town, they haven't closed, right?
Nope.
There's a lot of daycares that are operating.
Girls Club, YMCA.
Yeah. I mean, I know that was brought up to me, but it's in a small, very controlled environment. Kind of like Right at School is right now.
Well, and we need to remember that we've had schools start. Travis started, I mean, but again, to your point, Marquez, they have a different student ratio than we'll see in traditional public school.
That's the big part, is what we're looking at is with student ratios. We know that our ratios will not be as small as what you can have in those settings.
But with 3,600 opting in for virtual, we know that they're going to be smaller than we would normally see.
But remember, student ratio is teacher to student.
Yes.
And those 3,600 are going to pull teachers away. Right.
Oh, that's okay. Yeah. And what percentage roughly is most of that secondary? I would imagine that most of that's middle school, high school kids.
I don't know that number yet.
Okay. Because it's very different, as we know, for those pre-K through 2 versus those middle school, high school kids.
I'm sorry.
No, you asked all my questions. Dr. Atkins, would you please repeat the website address to find out more information about reentry plans and positive cases?
Of course. So if you go to midlandisd.net/fall 2020, we have built out all our reentry plans, our different scenarios. We also have Q&A for teachers, for staff members, for community members, for parents. We continue to update that as well. On that, you can also find information about transportation, all the precautions we have there. And then finally, the Midland ISD COVID-19 dashboard, should anyone be interested in the number of COVID positive cases we've had within just Midland ISD personnel.
I'm sorry, I do have one more, Mr. Riddick or Dr. Atkins. So there's a potential, we said 4-week. Depending on what those numbers look like, there's potential to do phase 1 in advance of the 4-week deadline, for lack of a better word. But what is the turnaround as far as notice for a parent? If we make a decision on a Monday, they're going the next Monday, how much heads up based upon the data that we're getting? Right. And collaboration with these other entities do we feel like we're going to have for a turnaround?
So parents will certainly need to have opportunity to make those plans. I know as a parent, I need that time, and we have to be cognizant of that. I have been engaging a variety of focus groups, both parent and teacher focus groups, and that's one of the questions that I'll be asking them next week. I had them in June, July, and then I had also told them in August. So these are some of the next steps that also we want to get their thoughts around as well. Not only looking at our local health authorities and what we see from the CDC guidance, but also from those groups as well that have engaged as thought partners with us.
We want to give as much heads up so parents can organize themselves, right? So they're ready to know that I've got to, get my, backpack ready, lunches ready, our time ready, pickup ready, all those things. It's probably never enough time. There's not enough leeway that we can give, say 2 weeks from now, we would launch this way. But we'll work to give us as much time as
But I think given
possible.
the situation, they're gonna hustle and get it. I mean, I think they're gonna jump on that opportunity even if it's a short window.
So.
They're gonna be like, yes.
I would hope so, and I think a lot of parents are probably ready for when that signal comes. I've got my student ready to go into this footprint so that we can get them established. I believe it requires some time, but our parents I would hope give us grace.
Absolutely.
And
I know parents are frustrated. Look, and to reiterate, for me personally, I mean, if there's any way to do phase 1 after Labor Day, we should be, as long as we are keeping kids safe and staff safe, we absolutely need to do that. As a parent that's got it all on the spectrum, I'm in phase 1, 2, 3, and 4. The kids just need to be schooled. I think that parents are frustrated, at least by the emails that I've gotten. I'm assuming that most of y'all got those too. But I do think at their core, there is a level of understanding of these times, and that and so we in no way, I certainly don't, and I don't think most in any way. We know the staff, the MISD staff has put in the work.
And we understand those frustrations because it's a frustrating time. We want to be able to plan, we want to be able to move forward, and I think people are just ready to move forward. So we totally understand and respect that. And so we're going to be moving forward, taking all those things into consideration. And again, what you said, making sure that our students and our staff, our community are safe in whatever we do.
Thank you.
Thank you.
Any other questions for Dr. Atkins? All right, thank you very much. All right, next 5B, academic update. Dr. Goodnow, welcome. Information begins on page 151 of the meeting packet.
Thank you, President Davis, members of the Board of Trustees, and Superintendent Riddick. I'm gonna give you highlights of this and then give you an opportunity for some questions as well. But I think we went into so much depth before. I do have Mike running the slides, I think. So we can just sort of start with, I'm going to give you an update this evening on the 2 really monumental lifts that this team has accomplished relative to professional learning this summer. And one of the biggest things that any district can do is welcome our administrators and teachers back with celebration and then really setting the tone for the year. So this year, again, I can think of all the pivot and the agility and the standing up and all of those words that we've heard so many times in the last 4 months, but this has been amazing. When I initially met or visited with the team in June, I really did emphasize, again, the critical need right now more than ever for attending to social emotional learning and really having the well-being of our staff, our students, our teachers, and our administrators first. And the reason is because we absolutely know that you can't access reasoning if you're in crisis and trauma. And I can tell you that we probably are seeing some of that tone, even in our community. Everybody is at that point, I think, of just extended crisis. And so what's important is to be able to really learn how to be present and mindful and focus on how we regulate our own emotions and take care of ourselves so we can take care of others, build trusting relationships with our students and our families, and really a sense of community. So the team heard that, And you can go to the next slide, and brought in for Administrative Institute, I think one of the most dynamic speakers who I've ever seen, and doing this in a completely virtual setting. The other thing we decided was to do this both kind of model for our teachers and our principals, the teaching and the new blended learning teaching model that we knew we were going to start moving into. The more a principal can experience that, and then a teacher can experience it as well in professional learning, the more empathy they'll have for our families and our students, and be mindful of the design. So Dr. Sines is currently at Texas A&M. I forgive him for that, but you know, other than that, he also went to Harvard and Oxford, so he scored some points. But really, his work is around emotional intelligence quadrant, and understanding that what does make all of the difference is relationships, and truly noting that great leadership is far more of a skill set. It's about how we relate to each other. So this was his kind of synchronous presentation to administrators. We are going to continue and follow up learning with Dr. Sines, and have some modules that will be available online, so that, again, you can go to an amazing 45-minute online or in-person inspirational presentation. But if we don't continue to really look at what we're offering and how those can be put into practice, and I promise you, in 2 weeks, we're going to need to remind each other of this. And so that's when we'll bring in more tools. One of the most amazing things he was able to demonstrate is how you connect virtually in a synchronistic setting, but then as well, how you can make that connection last even when it's asynchronistic for a student. So when students are not necessarily live with their teachers or their classmates, how can you still get them to connect? What we know is in normal, quote unquote, times, that students who have engaged in good social and emotional teaching and learning experiences, and that's not just really kind of that lesson on Thursday, it's where it's truly integrated. We know when teachers build strong communities and a sense of belonging for their students in their classrooms. And the same is true for principals who build that positive culture and instructional focus for the teachers and students, but really then that sense of community, that we see at least 11% increase in academic scores. Your discipline rates go down, your attendance goes up, engagement goes up. The measurements are really clear after 20 years of deep research. And now, again, we've got brain maps that show what's literally happening in the brain, so that when students can deregulate, when they can come in stress-free, they can access that prefrontal cortex and then learn to read. It's critical. And now more than ever, that matters. What Dr. Sines' message to us is that community is the shield, and it's the sword for the time of crisis that we're in. So I can't tell you how much I want to get our students in our classrooms so that we can start really addressing those needs and then accelerate learning. Some of the things we heard from principals around Dr. Sines was that it was one of the best, most invigorating and appropriate speakers that they had heard. Please bring them back. Be love, grace, mercy, kindness, and hope. There was tremendous support for moving in this direction, and we'll continue doing the work. I think we can go to the next slide. And so when we went into asynchronistic learning with our principals, we built their setting in Google Classroom. So they started to learn how to navigate Google Classroom themselves, so they could start learning what to look for in virtual walkthroughs as they go through really classrooms, and observing teachers, one, interacting with their students when they can live, two, seeing how they edit those live lessons down and then post them so students can get like 6 to 8 minute chunks of learning, and then three, what other interactive lessons they can do. So we were able to create over 60 hours, have 60 hours of content completed. We had 100%, 600 hours. We had 100% participation by campus administration, and quite a few of us in central office also were able to dip in. It did absolutely model best practices for online teaching and learning. And those are some of the topics that we covered, but there were, there were more, and I got daily reminders for what I had not completed. One of the most interesting things I found out today too is that there's a new book called The Main Idea that's been, it's a compilation from some of the best educational researchers in the country. Doug Fisher, Hattie, Nancy Fry, that are kind of giving us the 10 best practices. And, you know, sometimes, you know, you get these emails and you're like, we could have written that book, because they're telling us to start with social emotional learning and well-being for staff, to take the time to really think about how you're building your Google Classroom, which is what we teed up for administrators, to have interactive practices with your students. So going through what we were able to give administrators, we then started building, well, Elevate had really been designed several months before. But again, we can go to the next slide. We opened with Nikki Spears, attending again to what we're bringing to the table every day as teachers and understanding the power that a teacher has, whether that be in a virtual setting or really face-to-face in person. And again, being able to model how you can lean in, how you can do a strong video. That's one of the things we can see in this book, The Main Idea, which I wish I wrote. But it is really doing videos in 6 to 10 minutes and then having reflective interactions. So Adam Sines came back the next day and did a really personal and I think very appropriate, again, for teachers, slightly different presentation on the power of the teacher. And we had our Mr. Superintendent Riddick close us on Friday. Some of our live content area trainings then, so teachers could go into sessions, and we did have some glitches. Certainly, I tell people we learn that this is much of a learning process. That first morning, we kind of had too many, you really did have bandwidth issues. I'm sure I'm not getting this right, but it was firewalls. But immediately the technology team came together. They corrected that by splitting firewalls. I don't know. But they fixed it, and so in the afternoon, the following days, the stream was much improved. But these are some of the things that we did on these live settings. I can tell you all Wednesday afternoon was how to set up and meet every teacher, really meeting the proficient level on building their own Google Classroom. We also went through deep, intense, and really strong training on the multiple resources we have. So you have your standards and your TEKS alignment, and you know we are really looking at the essential standards. That's what Midland students need. So I'm really going to emphasize that going out and buying a curriculum isn't what's going to, one, attend to that personal interaction that is critical. It's two, not going to allow teachers to be agile, immediately see where a student is learning and where they're mastering, and immediately being able to see where there are gaps. And then bringing in resources like Achieve 3000, Imagine Math. We've got iStation, we've got Ponton's Fennell, we've got, for our students with special needs, there's an NTY, it used to be Unique Learning Systems, but it's a really strong way for adaptive curriculum. So there's a lot of resources that we are bringing in and then building in our classrooms. And that was really the whole Wednesday afternoon and then continued again on Thursday. So I do want to note that we're still looking at resources that we can pull in and model for the teachers and how to do that. And give the teachers time. They've had time built in for campus professional learning, and then also time to prepare their virtual classroom as well. I can tell you just a couple of great quotes here. So we did hear that this was some of the best professional learning that anyone's had, and I know that no matter what, when we get back, we'll continue to leverage our blended learning techniques. One teacher said, "I love Nikki's high energy presentation, and when she said that my heart, life, and happiness is 100% my responsibility, I am the hero of my own story." Another one of those things on that top 10 list was the importance of teachers being able to provide hope and students an opportunity to believe in themselves. So that notion of really coming with optimism, belief, and hope has tangible results. Haiti is one of the top researchers in showing what works or what strategies work that actually affect academics. And when you hear someone like Haiti saying that optimism, hope, and the students' belief in themselves is a tangible variable to make a difference in their academic achievement, I know we're getting it right with presentations like this. Teachers need to believe in themselves as well. And so giving them the space and time to build their classrooms, and giving them also tools to understand how to build that community gives them, I think, the sword and the shield that we need. I learned about some awesome resources, all of these resources that teachers are able to bring in: Seesaw, Pear Duck, Ed Puzzle. I enjoyed learning about all of the Google Chrome extensions that I can utilize to make my Google Meets run better and to support students with disabilities. So those are just a few of the quotes we heard from teachers. Let me just show you quickly, Mike, if you could bring up, I'll just show you. You won't be able to see it, but it's an impressive session catalog. We had 250 sessions and well over 1,800 participants in our Elevate catalog. And again, for a team to be able to do this, take what is typically like just such an energizing experience at Academic Summit. I've had the opportunity to do that with Mr. Riddick before, and he said what we did was nothing compared to what Midland ISD has been able to do. But I think that we were able to really hit the mark. But this is just an impressive glimpse into the many different sessions. And these resources, they can still go back and look. So if I wasn't able to get to one session, again, the beauty of kind of using the tools that we're now being forced to is I can go back, either listen to something that I didn't quite get or consider a new tool. I think I'm going to close with one of my favorite things tonight, because I want again to show you why it's so important that teachers learn these resources and then make them their own. Because we've got an ability to build not just the Google Classroom, but now a Google Classroom that has personality and character. So I think Jeff Horner is we're going to show off Jeff's his own personal Google Classroom. I hope they can pull it up for me. There we go. So when you get to Google Classroom, you'll be able to access materials in two ways. One is linear. I think my son would go the linear fashion. He's just that kind of linear guy. My daughter, who's dyslexic, would respond to this. So if you click on any of these links, like for a week, you could set up your Google Classroom. This is what we did today, by the way, in 18. So all of our learning as administrators is modeling what we're looking for in our students. So while it sounds very distant and it can be very difficult to sort of take that classroom and put it online, it's possible. And this is a way that it's different. The one thing we know is that Jeff might be a little more gray per his daughter, but that's another thing we can do is kind of, we can filter our Bitmoji for our Bitmoji classroom. Just a glimpse into how we're doing some of the things differently this year. Questions?
So a student, is that what a student looks at when they get on?
When they get into Google Classroom, the teacher will have, so this is like a kind of I would say level 3. We expect every teacher to come in level 2. So we taught with the expectation of proficient for your Google Classroom. And I'm telling you, I think we're there and we still have time. And so this is like a slightly more advanced. What we're looking for is more exemplary. And so again, if we can model exemplary ourselves, and I'm telling you at my age, if I can build this, and I mentioned it to him, but he beat it to me. So that, I want to do my own, but he got there first. But if we can learn to do this, I promise you, the teachers have already done so many. I'm telling you, what I've seen already in Midland ISD from teachers is blowing me away. The use of video and their Bitmojis. I'm getting chills to think of it. So that's exemplary, right? But a student would log on to Google Classroom. It's very, very consistent what they'll see in every classroom. That's also different. But there'll be a way for them to get to this page. My son might rather go on the links. My daughter will know where to find this and jump on this, if that makes sense, because she's so much more visual.
Right.
Okay. Why did the high schools convert to Canvas and not do Google Classroom?
So that's a great question. We had one school that and Mr. Riddick, you can, because you're here.
So the university uses Canvas. And so last, in the school year 2019, Midland High wanted to go down that pathway to move into Canvas before we had Google Classroom as options for teachers, but we were not pushing it wholesale in the spring like we did in regards to, we got to get a platform that everybody can operate on. Yeah. So we allowed them to say, okay, go ahead and move down that pathway. You were going to do it previously already. You were going to go down that path. let's go ahead and let you continue down the learning that you've already built up and did, and go down that pathway to construct your student environment to learning via Canvas. So these are just other providers that support classroom activity. In college, you may have thought about Blackboard, Canvas.
The thinking they're training those kids so when they go to college, Midland College, UTPB, they've already got that knowledge.
Or other universities, right. And so early college, high school uses Canvas because of Midland College.
Yeah.
And so very much a fluid interaction that you have with that. And I would say it's a lot more robust in what it delivers. What we had to work with is that we have some early adopters that were in the Google Classroom footprint. And we had to make a decision. Do we go and integrate something entirely new for the entire district and push that out, including our early adopters around Google Classroom? Or do we look to integrate Google Classroom as our embedded practice going into this year, knowing we have early adopters that can help us move everybody along?
No, I just found
That's fine. Yeah, I think they predated COVID, but we did. It was one of the first questions that I think I had to answer, and you know, and knowing that TEA was coming out with the learning management system, which is really great, but it came out, you know, a month too late, right? So I think our teachers have been through so much change already that it felt right to really maximize and, you know, this platform district-wide.
Any other questions for Dr. Goodnow?
I'd like to say, Mr. Davis, Dr. Goodnow, I appreciate the work and the time that you all have put into this program, and knowing that you feel like that our teachers are buying in and being energized. So if and when that opportunity comes for us to get our children back in the classroom or doing the virtual learning, that it will be something that our students will be also energized under the same manner that these opportunities are for them. So thank you.
Thank you.
All right, any other questions? All right, thank you, Dr. Goodnow. It's very helpful, very informative. All right, next district report is a report only unless there are questions. The innovation update begins on page 157 of our meeting packet. Now turning to 5D, the financial update is also a report only, begins on page 159 of the meeting packet. If there are no questions about either of those two reports, then we'll move to district report 5E, facility update. Information begins on page 162 of the meeting packet. Spencer, welcome.
Good evening, President Davis, Board of Trustees, Superintendent Riddick. As we talk about our facilities or discuss our facilities, it's important to remember that the center of our work is really about providing educational environments that support our educational delivery programs and the academic success of our students. You did receive the update in your packet as well as an email last week that highlighted some of this information as well, but I want to provide a brief update regarding each bullet. The committee has been established for the RFQ for the educational planning services. It's important for you to know that of the statements of qualifications submitted, those 6 that meet the qualifications have assembled phenomenal teams. And the committee is working now to evaluate those. Those evaluation scoring rubrics from each committee member are due to Ms. Pena by Wednesday. And then once the firm that best meets our needs is selected, then contract negotiations will begin with an expectation that that contract is presented to you in September for approval. HVAC systems. It's important to note again that this update was as of 1 p.m. on Friday, and with HVAC systems running throughout the weekend, we have been informed of additional complications. There was an issue at Fenton Elementary reported to us this morning. We identified that one of the chillers, the control display, is malfunctioning. We were able to bypass that control, and now now that chiller at this particular time is 100% functional. The building, it's actually the pod area of Fannin Elementary is now cooling, and a quote has been requested so we can display, or excuse me, so we can replace that display. In addition, temperatures were less than optimal at Midland Freshman today because of a power outage. The latest update I received was at 5:45, and Encore was on site. They have identified a malfunction within the transformer, and they are replacing that currently with an estimated time frame of 4 to 5 hours to fix that, but it will be fixed tonight. If necessary and we need to reset the systems, the teams will be called out to make sure that that's done tonight, so that air conditioning, all the HVAC systems are functional tomorrow and ready to go for staff. Also, just thinking about COVID and coming back into buildings, it is important for you to know as well, although done previously as buildings closed, that the air exchange rates have been adjusted, making sure that the airflow within our buildings meets the CDC recommendations. Ms. Douglas, Director of Health Services, has been in contact with Memorial or Midland Memorial Hospital to confirm that what we're doing is in line with what they would recommend as well. And then elementary RO systems, that contract has been through legal now and was sent for signatures today. And so as indicated, once that contract is finalized, meaning we have signatures for both parties, then that project is anticipated to be completed within 120 days. Not on your update, but I do want you to know as well, because it does have to do with operations and ensuring that our delivery, our environments are ready for instructional delivery. The webcams that were ordered for teachers did arrive today. And so they will be distributed starting this afternoon and tomorrow to make sure that they're ready to go for Wednesday as well. So any questions?
I've got a question on the air system. So I haven't heard or know of, but I'm asking a question. Is there any way to detect a detection device, like at the front of the building or in the main hallway, that can actually be tested at one device at the end of the day and say, hey, I mean, we have a COVID registration type deal? Does that make sense?
For the HVAC systems?
Yeah. Is there something now that you can set up to detect? You know, you had 100 students come in and they were walking around the building and nobody reported nothing, but at the end of the day, there's a positive test that shows up on a device somewhere, or reading, or where they've been touching or they've been passing through.
So I know that there's research being done around filters and can filters because of the airflow. Can you test the filter to see, does it have some contaminant within it? There's nothing out that allows us to say, much like a smoke detector or any other, that allows us to put something up to say there's a presence of it in the area. You may not know who, but you know that there's a presence within the area. So you know that there are some things that you can do to mitigate it. Hope in our future that there may be some things that we learn down the line that allow us to mitigate it in a much better way because of detection. Because we don't have that right now, we have things that we are looking at doing from thermal scanning for students so that we can see, are there any indicators that we have that allow us to know that there may be a possibility to have more questions of rise in body temperature, as an example. There is the UV lighting that we're bringing into buildings to help on the capacity side that allows to bring those machines into a room to clean a room while staff member is actually wiping hard surfaces in another room, and then you can switch them the next day. So we're bringing in some of the airflow, so the air handling of the quality of air that's coming outside, inside, that you're getting that flow that comes through. That allows us to work through the mitigation to help us understand more as we get further down the line. I think as we get further down the line, then we'll have some other abilities to think of what other innovative devices that are out there that can help us long term, not just for COVID, but for other things as well.
So is there right now, besides the method of you going to see the doctor, and I think there's some New Testament that's shoving that long deal up your brain there.
Saliva test.
Yeah, there's not a wipe test for a building to say, okay, there was 10 cases reported here, and we're going to take 3 places and sample, and then have it tested.
I've not seen that as of today. I'm sure there may be something to do with the surface, and then much like you do with the nasal swab that occurs.
Mm-hmm.
I'm sure there may be the potential of doing something like that. Not familiar with it. I know recently there is a saliva test that you can provide, working through the quality of what that means for positivity or quality. So things are emerging along the line that we're looking at how can we integrate that into our building to help our families feel that their kiddos, when they are with us, are in a safe environment.
So the chemicals that we currently use are not chemicals, but disinfectants or whatever, are they pretty much, I guess, like the rest of the stuff, 99.9%?
Correct. We have a requirement on chemicals of what we can use and can't use in our facilities.
Mm-hmm.
And so there's OSHA provides what public buildings can use in regards to their mapping for chemicals. There's a guide, a book, can't think of the book right now, someone might be able to share with me, that allows us to know, okay, these are the right chemicals that we use. And it has all your contents and information about what that chemical has. That's what we have in place. Strong guidelines around what disinfecting chemicals are used in our school buildings because of allergies and everything else.
Correct. And I'm asking the questions so the public will hear that information and know that there's a standard set and that we're not just using some mixture that's hasn't been agreed upon or looked at already. So,
and if I may, just to piggyback on your comment as well as for the public to know, although we've been working this summer to make repairs and ensure that all sinks and those types of things are working, our nurses are now going behind us and double checking that work so we can ensure that every sink is operational, the restrooms are ready for students to return, that the water fountains have been valved off, RO systems are ready that are currently in place. And so we're just double checking to make sure that we will be ready when students return.
I'm glad to see phase 1 of the RO, and I'm glad to see specific campuses on that list, given history. But how was the determination made for what campuses were phase 1, what campuses are phase 2? Do we?
No, I don't have that information without speaking to the team to say, you know, what made us go into this category and list these schools as opposed to our other schools. And
some of those we clearly had issue with prior, which makes sense.
Think, well, one specifically,
yes,
right? We
right.
want to make them a phase 2, and
right?
Certainly get them in phase 1 and get that operational. But I couldn't speak to the rationale.
Yeah, and I continue, and this is a sidebar from your report, and I'm sure it's part of the transition, but I continue to get a request from a couple of constituents about district property that's owned, a consolidated list of district properties that we own, not necessarily campus, but lots maybe that aren't being used or occupied.
Not many. There's some property.
Right. And so if we can get that list, I think it'd be interesting to update the board just in general on that, but certainly to get that to those.
We actually have the team going on, our newest members going on a tour on Thursday to see all of our locations all around the entire area. But not many. I mean, we own the golf course and the west, right, and then north, 249.
Yes.
And then there's a small area off of fairgrounds that we have as lot property, and then a small area southeast of town, a small warehouse that sits out there for storage.
I can probably find that email if I needed to and forward it to you.
Yeah, if you would.
Yeah. Okay.
Ms. Spencer, I assume that before our teachers entered the classroom, we had deep cleaned all the classrooms and sanitized properly for that.
Yes, sir.
Do we have everything ordered for supplies for kids to be back in class? Face shields for teachers, hand sanitizer, wet wipes. Are we planning in advance for those things?
We have, yes, and as you know, TEA has helped support that endeavor as well, and so campuses have received items as well as their items in the warehouse. And they've been given established procedures for how they request those items from the warehouse and then how additional items can be ordered.
Right, so that's soap, hand towels, all those things that we know that we normally go through, that we knew we had to start creating a warehousing opportunity for what that looked like, greater than what we were currently using. So back in the spring, there was a lot of back ordering around that, but we've gotten a good jump on what's available for students 3 through 12 that would be required around a mask, face shields, gloves, short on Lysol, that's just a natural around everywhere, but certainly have Clorox wipes that we have available as well as others. We have plenty of, it's usable. It may not be the quality, but it's usable. Yes, plenty.
Spencer, the question I have, so like we've had some employees that have tested positive that have been at some of the facilities. The places that we clean and the places they've been, are we documenting those areas?
Yes, we are. And in addition to that, once the areas are clean, then we're making notification to the appropriate individuals so everyone is aware that they can be occupied again.
And again, on the fall website, fall 2020 website, there's a category that lists there that tells everyone the school and the date, whether closure was necessary or not, or did it occur, so that we can get in, get it clean, get it remedied, so then we can get back into an operational status. We have that available for our public, so it's out there. And then there's a whole nother process, like Ms. Spencer shared, that we follow in regards to the guidelines. We want to let people know, right, that are in proximity of that individual through our contact tracing, what we need to do to inform them about next steps. And then we inform the rest of the population.
So someone shared a story with me about, might not fall in the facility part, but it kind of does. But so someone shared a story with me the other day about how I'm trying to generalize it, that there was a person in a room, there was an instructor in the room, and then there was a service person that was going from room to room and was not wearing a mask and caused the other person to get quite excited. So is it a policy for the district that all district personnel will wear masks inside of buildings
Yes,
at
sir.
all times, or just transitioning, or if the person is completely by themselves, they can not use the mask?
Right.
Or how clear is that point to every employee in the district?
So we're pretty clear. Can't tell you that you're not going to find someone that's not going to meet what that expectation is. So I work to set the example. So in my office by myself, I can be unmasked. Someone comes to my office, I go ahead and put my mask on. We meet together at my conference table. Three of us, all three of us are wearing a mask at my conference table. So there's an expectation when I walk out of my office that I walk out with my mask. Won't tell you that I've not walked out, forgot, had to return back to get my mask, to go back out to the kitchenette or somewhere else down the hallway to another office setting. It's an expectation that we have in this building. It's one that we want to carry over. Cannot say though, again, that you won't find someone who feels that in the working of what they're doing, they may have either forgotten a mask, left a mask, or did not put a mask on. That will happen, and will self-correct when it does.
I think the comment also that was made to me that it was a self-liberties and they had the right not to wear it. How can we govern that with our district and tell the individual that they work for the district and they will wear a mask?
Right, and I mean, we're complying with the governor's order. That's what we've shared out to our employees. If we have a governor's order that requires masks, there are some exceptions, but we're required to. Thank you. We're required to follow the governor's order, and so any argument that they have, a personal right to, they can
they can make that argument. I don't think it's a great argument, but they can make that argument. But we have a law to follow, and that's what we're trying to do as a district.
And again, while there may, as Mr. Riddick stated, be exceptions, I've had the opportunity over the past 3 weeks to visit numerous campuses and facilities, primarily as an employee, but also as a parent registering. And in every instance, people have been in their masks, unless I walk by a classroom and the teacher is in there by herself. She or he may not have on their mask, but everyone else that is in an office area or in common areas, I have seen them in their masks.
Thank you.
Mm-hmm. Absolutely. Thank you.
All right, thank you, Mr. Spencer. Next up is agenda item 5F, our staffing update by Mr. Bailey. The information begins on page 164 of our meeting packet. Mr. Bailey is joining us via conference or via video conference.
Good evening, President Davis, board member, Superintendent Riddick. I feel like I have the best job this afternoon to get to bring some good news, and also I didn't have to answer that last question, so I will at some point, I'm sure. But included in your board packet, I have detailed information about district staffing. If you can go ahead and turn the slide. This month's staffing report and update is a very positive update and one that I'm pleased to present. Current staffing trends also show major progress this year. I'll briefly update you on our retention data, the fill rate in district classrooms to start the 2020-21 school year, and the process we will use going forward to make staffing adjustments as necessary. Next slide shows the employee retention, and employee retention is a major goal and focus for the Human Capital Management Department, and it is vital for any organization, and especially for Midland ISD. Over the last 2 years, we've initiated numerous retention strategies that have proven to be successful. So when you look at the graph and more detailed data was given to you, you do see that there was a significant decrease, a 30% reduction in leave employees that were resigning or retiring this year. And so that's a major contributor to our retention rate. And so it's something that we're very proud of. And over the last 2 years, we've initiated numerous retention strategies that have proven to be successful. Some of those include revamping campus staffing procedures, ensuring that principals have staffing numbers before March so that they can adequately plan for the next year, addressing employee compensation. We appreciate the board for approving raising teacher salaries an average of $6,000 in 2 years, and also increasing the hourly rate from $8 to $12 over the last 2 years for our support staff. We've also addressed major improvements to health benefits for all employees without increasing contribution rates. And this includes an employee wellness program that helps our employees to monitor and address their health needs on an ongoing basis. Also last year, we launched employee childcare from a few seats at Coleman High School to an entirely new center at Henderson, and both centers, we're glad to report, have received the Rising Gold Star rating, which is the highest that can be given to childcare centers. And we have a waiting list of more than 40 children waiting to get into our employee childcare center. So there's plans to hopefully expand within the next year. We've also gone about trying to address opening avenues for employee feedback with an anonymous reporting system, in-person exit interviews, and exit surveys available to every employee leaving the district, conducted by a third-party administrator, K-12 Insight. We also contracted with ESS to recruit and manage the substitute management program for the district. And in its first year, they improved the weekly fill rate from 68% to 83%, which is a 15-point increase, which contributes to the employee satisfaction, so teachers feel better about scheduling critical appointments when necessary. So professional and certified staff, this slide basically shows that the retention rate increased by 30% for classroom professional certified staff. Next slide, please. As we've said many times before during the monthly staffing update, retention is key to starting the year with qualified staff in every classroom. And this slide details the current classroom staff fill rate. We're starting this year with 93% of our classrooms filled with certified staff. Last year, that number was just below 90%. With 85 classroom vacancies remaining, 42 of those are being filled with long-term subs who are degreed and at some point in the process of becoming certified. It leaves us about 43 positions. And when you look across the district, that's about 1 per campus. And just to give you an idea, some of those positions will be deleted and not be filled based on enrollment. Some will be covered by other professional staff and that are on campus, like a campus interventionist. So those numbers are factored in as well. And then once we have a better handle on what student enrollment will look like in the coming weeks, we'll be able to reallocate some of those positions to other campuses. So the district is staffed. We're in better shape than we've been in several years. And I believe we're ready to attack the work, and we feel we're in great position to start the 2020-2021 school year. So board members, this concludes our August start of school staffing report. Do I have any questions?
Are we still contracting out some virtual learning? I know at one time we required services to help us. I think it was at the high school level.
Yes, sir. We do work with proximity for some of those hard to fill positions that maybe there's and I'll use it as an example, Mr. Marquez. There might be a German class, for instance, that there's only 28 students interested in taking that class at a particular campus. So instead of hiring a German teacher, it is much more feasible to hire through Proximity, is the company that we contract with, hire a particular section for those students so that they can still take advantage of the coursework, but also it's cost effective for the district because we don't have to hire an entire teacher for that German position. And as well, sometimes it's very hard to find a German certified teacher. So yes, we do.
Okay. Thank you.
Any other question, Mr. Bailey? All right. Thank you, Mr. Bailey. Thank you to you and all your team for all the good work. We appreciate the good report. Thank you very much.
Thank you.
Now turn our discussion action item 6A, First Tee West Texas Resolution, Property Use. Information begins on page 167 of the meeting packet. Mr. Reagan, who will present?
Good afternoon, Board President Davis, Board of Trustees, and Superintendent Riddick. Tonight we bring forth to you a resolution to allow First Tee West Texas to lease a major portion of the North Fields for their use as a golf program, primarily for the Midland ISD golf program and secondary and elementary facilities. As you know, First Tee is primed to spend almost $1 million worth of improvements to the North Fields for this program, and they're ready to move forward with a lease agreement with Midland ISD to be able to lease these facilities for a 5-year lease with First Tee and Midland ISD. We have submitted in the packet the proposed lease agreement, and tonight we are presenting the opportunity for the board to pass the resolution which would allow Midland ISD Superintendent Riddick to initiate a contract with First Tee West Texas.
Motion to approve.
Second.
Motion by Mr. Trischetti, second by Mr. Marquez. Any questions or discussion that's not covered by the information in the meeting packet? All right, all those in favor, please raise your right hand. I see Mr. Kinney's hand. The motion passes. It's unanimous. Thank you.
Trustee Davis, if I can have just a moment, I want to share that this is actually Mr. Riggins' last board meeting. He's provided 30 years of service to the district. Has been faithful and has done an incredible job to allow us to get to a point, much like with First Tee, to expose something to our community that could be long-standing for years to come as they teach kids the commitment to service as well as the commitment to the sportsmanship around golf. Wanted to publicly thank him for his work and bring that to the attention of our Board of Trustees as he embarks on his newest journey, which will come at the end of the month, and wanted to recognize that this will be the last time that you'll get him in a board meeting.
Thank you.
Thank you, Mr. Regan.
Yeah, thank you, Mr. Regan, for all your service and for all that you've done for the district. It's a well-earned retirement. We wish you the very best.
Thank you. Enjoyed serving the district. Thank you.
Thank you, Mr. Regan.
All right. Our next discussion action item is 6B, the Teal submitters approval. The information begins on page 230 of the meeting packet. Presenter is miscellaneous. Will she be accessing the same room that Mr. Regan is exiting, or?
I will see you in just a moment.
Okay.
I mean, it's pretty cut and dry. I don't mind.
Right. If not, what I'll do is I will launch into the presentation for this. Here we go. Yes.
Welcome.
Hi, good evening, President Davis, Board of Trustees, and Superintendent Riddick. Here this evening to present on the Texas Education Agency Secure Environment System. So this is a system where district staff can access confidential and secure information through various applications that are available in the secure environment. And since 2009, our CFO and the Executive Director of Accountability and Student Data have been the alternate approvers to accept staff requests to obtain access to the secure environment. So I'm here this evening to recommend that we continue with this process for the 2020-2021 school year, and that we continue for the Executive Directors of Accountability and Student Data and the CFO to act as alternate approvers for the 2020-2021 school year, to accept applications or requests from the district staff for access to and to approve access to this environment throughout the upcoming school year. I'll be happy to answer any questions that you might have for me at this time.
Mr. Davis, I make a motion that the board authorize Claudia Alanis, Executive Director of Accountability and Student Data Systems, and Daryl Dodds, Chief Financial Officer, to act as the superintendent alternate for approving staff requests for access to one or more TEA web applications accessed through the Texas Education Agency Secure Environment TEA Login, or TEAL. This authorization is valid for calendar year starting August 31, 2020 through August 31, 2021.
Sir.
Second.
Motion by Mr. Trischetti, second by Mr. Fuller. Sorry, John.
That's okay.
Any questions?
Yeah, just out of curiosity, why don't we, why is the date not line with our?
Robert, your microphone's not on.
Hey, turn this way. Why is the date not lined up, I guess, with the fiscal year? Out of curiosity, just why don't we go from July, June, the end of June to the end of June?
Right, Mr. Marquez. So TEA just currently has it to become effective August 31st to the next year, August from 1 year, August 31 to another calendar year of August 31 of the upcoming school year. So it's not school year to school year. Not exactly sure why they have it that way, but you're right. It is from August 31, effective this August 31, 2020 to August 31, 2021.
So no legal issue?
It's not a calendar school year.
I mean, this is simply, I think, authorizing people to access the system, so I don't think there's any parts that need to go along.
Okay. All right.
Any other questions? All right, all those in favor, please raise your right hand. See Mr. Kennedy's hand. It's unanimous. Motion passes. Thank you very much. All right, it's 7:03 p.m. and we will go into closed session in accordance with Government Code Section 551.071 through .074, Section 551.076, and Sections 551.0821 through .084. Thank you very much. All right, it's 12:07 a.m. on August 18. We are merging from closed session.
Everyone else had enough to call.
We still good to go? All right. So to repeat, it's 8:00. We're emerging at 12:07 a.m. from closed session to take up agenda item number 8, action arising from closed session. 8A, superintendent evaluation. We have evaluated Superintendent Riddick during our closed session and ready for any action item.
Mr. President, I move that we continue, not extend Mr. Riddick's contract, and that we continue discussion on this item at a specially called meeting on Friday at 2:30 p.m.
All right, motion by Mr. Trischetti. Mr. Kennedy.
I'm Mr. Kennedy.
Sorry, Mr. Kennedy. Is there a second? Second by Mr. Trischetti. Any discussion? All those in favor, please raise your right hand. Seeing Mr. Kennedy's hand, it's unanimous. All right, it is 12:08 p.m. and we're adjourned until Friday at 2:30 p.m. Thank you all.